Great. So I think we're exactly at 4. Before I pass it over to our chair, thank you all for joining again. This is a quick reminder, if you could just make sure your lines are muted if you're not a speaker, and turning off your video as well. That'll help us kind of keep the call moving. So with that, I'll pass it over to you, Commissioner.
Thank you so much. Thank you so much, Kirsty. It is great to be here and to be on the call with all of you. Of course, as I'm sure all of you, we wish we were in person at the NACo conference, and we are not able to do that. But hopefully next year we'll be in a business meeting like this in person. But I just want to say thanks to all of you for joining us remotely, as we all are. I will say our governor and his administration are releasing as we speak the Minnesota Safe Learning Plan. It's how our schools are going to be going back to business. So this is in Minnesota, so it's a big day for Minnesota when kids and families are learning about the school return policies. But I'm just happy to be here and remind you that all your lines are going to be muted, and this meeting will try to end the meeting by no later than 5:30 Eastern time, which will be 4:30 Central time. So I am Mary Jo McGuire. I am a Ramsey County Commissioner in Minnesota here, and I chair Healthy Counties. I hope you're all managing to stay safe and healthy during this uncertain and challenging time. As we continue to tackle COVID-19 pandemic in our communities, I am proud to see how local governments are leading to help protect the health and safety of our residents. Before we begin, I would like to recognize the outgoing vice chairs of the Healthy Counties Advisory Board and thank them for their year of service. Tony Carter, Commissioner, Ramsey County, Minnesota. Thank you, Tony. Sig Hutchinson, Commissioner in Wake County, North Carolina. Thank you, Sig. Nick Mascioni, the Health and Services Agency Director from San Diego County, California. Thank you, Nick. Greg Puckett, Commissioner, Mercer County, West Virginia. Thanks, Greg. And Kenneth Wilson, County Administrator, Franklin County, Ohio. Thank you, Greg. Thank you, Kenneth. And Carol Reynolds, the Executive Vice President of the Client Experience for NetSmart Technologies. Thank you, Carol. And I also want to thank Commissioner Lenny Eliason, who's on this call and who's the initiator of Healthy Counties when he was the president of NACo. And I just always like to recognize his vision for having Healthy Counties be an initiative that we've kept going. So thank you, Commissioner Eliason, for that. I want to thank all the vice chairs and all of you members for your leadership and dedication to improving health in our communities. I also want to take this time to announce our incoming Healthy Counties Chair, Ken Wilson, one of our vice chairs. He's the County Administrator of Franklin County, Ohio. Ken has been an active vice chair and member of the Healthy Counties Advisory Board, in addition to his work on various NACo initiatives, including the Health Steering Committee and the Large Urban County Caucus. I'm going to now pass it over to Mr. Wilson for a few brief remarks. Congratulations, Ken, and we welcome your comments. We're experiencing the joys of technology. Ken, are you? Well, while we're waiting for Ken to come on, which is great, we can, I want to thank our sponsors, and then Ken, I'm going to give you a few, I'll give you a few moments after I thank our sponsors for your remarks. So we couldn't do our Healthy Counties work without the help of our sponsors. And so I want to thank Esri and Massimo and the National Association of Home Builders. I want to thank NetSmart and United Healthcare Optum. And also our Healthy Counties sponsor, Aetna, for their support of the advisory board and virtual health partners for the healthy recipe cards that we were able to share with our members. I hope you got your recipe cards. I especially love the almond butter and berry wraps. So look for your recipe cards. They're great healthy recipes. So I'm going to check now to see if Ken is on the line for for giving a few remarks. Ken, are you there?
He's on the line. We're just figuring out.
We're just waiting for him to be able to hear him. Well, Ken, we're so happy to have you here, and I can give you time whenever. We can hear from you at whatever time we figure out the sound on this. So when you're available to speak, just let us know in the chat room, or let someone know, and we'll make time for you on the program then. I'm hearing some sound, but I'm not sure that it's there. But I'll just keep going. Oh, are you there?
Yes, it's Kenneth Wilson.
Oh, great. Welcome, Ken. How about if we hear from our incoming president? Congratulations and thank you, our incoming chairperson.
Oh, thank you so much. I am very much looking forward to serving as chair of the Healthy County Advisory Board. I've been involved with the initiative since its inception, I believe. So I've spent a lot of time working on the various issues in promoting healthy communities and advocating for public health policies. I'm very much locked into the issues around racial equity and how that has impacted and continue to impact health outcomes. So I'm looking very much into how NACo can really change the direction of health in communities that have been negatively impacted for generations due to structural racism.
Thank you. Thank you so much, Ken Wilson. We really look forward to having your leadership in healthy counties, and we know that you'll do a great job there. So I'm excited. I get to stay one of the vice chairs, so I'll get to stay working with you and with all of the amazing people that are involved with healthy counties. So thank you so much. We look forward to your year.
Thank you.
So yes. And so I also want to thank, while we're thanking people, I want to absolutely thank our NACo staff, Kirsty Fontaine, Nastasia Walsh, and Pamela Mann, who have really kept the work going throughout all the challenges of this past year when we weren't sure what was going to be happening with our conferences and with our agendas. And they have just been steady and informed, and just making sure that we're getting the best information. So I just want to thank Kirsty, Nastasia, and Pamela for all of your work this year. So we really appreciate it. So with that, our meeting today is going to be primarily a panel discussing racism as a public health issue. But before we jump into that, I'd like to turn it over to NACo staff to provide instructions for tech support and using this Microsoft Teams platform so that you can be able to ask questions and be a part of this discussion that we're going to have. So thank you. So I'm turning it over to Kirsty.
Hi, thank you so much, Commissioner, and thank you all for joining us today. I'm going to walk through a few features of the Microsoft Team platform, as well as some brief updates. Before we jump in, just want to let you all know that we have set up a hotline for you all to call should there be any tech issues. And that number is 202-350-2296. And I will drop that in the chat box, and that number is also included in the email you all should have received. You'll notice that hopefully everyone is muted. We'll ask that you keep your lines muted for the duration of the panel and utilize our chat feature to pose any questions or make any comments that you may have. The button for the chat feature is a small box icon located in the control panel at the bottom of your screen. And if you're having any issues accessing the chat box or receiving a message you don't have access to it, logging out and logging back in should be able to fix that issue. Again, to make sure all of our eyes stay on our panelists and speakers, I'd ask that everyone please turn off their videos for the duration of the panel. And again, I will drop the number for the tech help into our chat box shortly. Before we move on, I wanted to quickly reiterate our thanks to our Healthy County sponsor, sponsors and bring your attention to the recipe cards that we included in our emails to attendees. Had this meeting been in person, as many of you know, this panel would have likely happened during a Healthy Counties lunch. So in lieu of that, we worked with our partners at Aetna and virtual health partners to bring you all 3 summer recipes to keep your energy up while still staying healthy. Virtual Health Partners is also currently running a 30-day free trial period of their platform for all county officials and employees. And you can learn more about that by clicking on the link on that first page of the recipe document. And finally, NACo is extremely excited to announce our new county resources on race, equity, and inclusion webpage that actually went live earlier today. We've included information and links to current county declarations and resolutions outlining racism as a public health crisis, as well as showcasing county efforts aimed at addressing racism at the local level. Our aim is to uplift county actions that strive to diminish inequities and amplify local approaches that lead to the improved outcomes for residents, for all residents, regardless of race. We're currently working on adding a feature that will allow our counties to share their work directly to this page. And this can actually be found if you're on our website, it's under the topics tab. And again, we're super excited and we're looking forward to continuing this conversation and amplifying all the hard work you all are doing. And that's it from me. Back to you, Commissioner McGuire.
Thank you so much, Kirsty, and thanks again to Aetna. We're gonna have to go onto that Virtual Health Partners website, so thank you so much. So as I've shared before, Healthy Counties is a unique group. Though we sit squarely within health, the Healthy Counties Advisory Board has often served as a melting pot of topics on various issues that ultimately influence the health of our communities, and racism is no exception. As we battle the COVID-19 pandemic, the disparities in prevalence and fatalities in our Black, Brown, and Indigenous communities continue to highlight historical and present-day injustices and discrimination. Compounded with the murder of George Floyd and countless others by the hands of law enforcement, counties have been spurred into action like never before. To date, nearly 40 counties have passed declarations or resolutions acknowledging racism as a public health crisis and outlining steps to address its impact on our communities. And I'm proud to say that just last Tuesday, Ramsey County passed our countywide racial equity policy addressing the ongoing impacts of racism in Ramsey County. We took action to expand the application of our countywide racial equity policy statement to cover Ramsey County elected officials in all areas, acknowledge that the legacy of and ongoing issues caused by racism requires recognition, reconciliation, and repair, and to further advance race-forward, collective, trauma-informed, and preventative strategies in direct partnership with the community through a holistic public health approach as part of building a community in which all are valued and thrive. And that was our action that we took last Tuesday, and I'm really proud of us that we were able to do that, and we have great support from our community partners. I think it's also somehow very appropriate that today, this afternoon, the world celebrated the life of Congressman John Lewis, a true champion for racial equity and justice. And I'm just so grateful for the work that he and many others before him did to help make all of this happen. So today we're going to hear from local leaders who have passed such declarations and are engaged in this work. Our hope today is that we learn from one another and continue to fight against racism towards the betterment of all our communities. As the panel progresses, please feel free to use the chat function to pose any questions you may have or share any race equity efforts underway in your own county. At the end of our panel, we will have time to answer questions for the group. With that, I'm very excited to have Robert Montoya with the Government Alliance for Race and Equity, who is going to lead our panel discussion after making some remarks of his own. We're just so grateful, Roberto, that you're here. So thank you so much, and I will pass it over to you.
Thank you so much, Commissioner, and it truly is a pleasure to be here. My name is Roberto Montoya, and my preferred pronouns are he, him, his. And I just couldn't be more excited to be here in this moment talking about this very important topic. I'm coming to you from beautiful Adams County, Colorado. I am a proud son of New Mexico, but I've called Colorado home for the past 22 years. Currently, I serve as the Gare West Regional Manager with Race Forward and the Government Alliance on Race and Equity. Before joining Race Forward, I worked at the City and County of Denver as a manager of diversity engagement, doing large-scale equity work with many of the agencies. And a lot of my work was centered at the Denver International Airport. Before that, I was teaching for 6 years at the University of Colorado, Denver in the School of Education and Human Development, teaching courses on the foundations of race in large systems. My PhD work and my research focuses primarily on race in large systems, and I'm proud to say that I'll be defending my dissertation in the next several months. But with that said, I'm really happy to be here representing Race Forward and GARE, because what we do is we imagine a just, multiracial, democratic society free from oppression and exploitation, in which people of color can thrive with power and purpose. And the work that we do at Race Forward and GARE really looks to catalyze movement building for racial justice. And we do that by partnering with communities, organizations, and various sectors to build strategies to advance racial justice in our policies, institutions, culture, and practices. So needless to say, the work is not easy. And that's why we're here today, to just talk about the importance of the work and how, when we're talking about equity, it's not something that you can wish in. It's something that you have to work in. One of my favorite authors is a scholar out of UC Berkeley, and his name is Zeus Leonardo. And he wrote a beautiful book called Race Frameworks. And he starts the book off by saying this. He says, race work is never easy. It's full of tension, and it's ripe with contradictions. However, we must recruit all the help that we can get, and our analysis should be as complex as the topic itself. That's really how I approach this work, and why I'm so honored to be here talking with experts who are taking very complicated topics and even having more complicated solutions to those topics. And so I'm very happy to be here and to introduce our panelists today. So it truly is an honor to be here and to be with you all. With that said, I have the distinct pleasure to introduce our panelists, and I'm just going to go in order. Our first panelist is County Executive Crowley, David Crowley, who was first elected to the Wisconsin legislature in the 17th State Assembly District in 2016 and reelected in 2018. During his time in the legislature, he focused on criminal justice reform, racial and economic equity, and housing discrimination. And on April 7th of this year, he was elected to serve as Milwaukee County Executive, sworn in on May 4th. This comes at a critical time in Milwaukee County's future as they pursue a bold vision to become Wisconsin's healthiest county by achieving racial equity. And in 2019, Milwaukee County was the first local government in the country to declare racism as a public health crisis. We're so happy to have County Executive Crowley on our panel today. Joining him will be Joanne Pierce, currently who serves as Durham County's government's General Manager for Health and Wellbeing. Joanne's portfolio includes public health, social services, library, veteran services, cooperative extension. In addition, Joanne oversees the racial equity work to advance equity across the entire county enterprise. And in May of 2020, Joanne hired Durham County government's first ever racial equity officer, whose work includes strategically integrating racial and social justice principles and practices to address inequities with the goal of improving outcomes for everyone. So happy to have Joanne on this panel as well. Joining them will be Kimberly Crunk, who is a longtime resident of Eau Claire, Wisconsin, and was appointed to the County Board of Supervisors initially in the fall of 2016. She serves on the Board of Human Services, the Aging and Disability Resource Center Board, and was appointed to chair this spring, as well as recently be appointed to the Police and Fire Commission. She's been an RN for the last 11 years and has worked in a variety of settings, including corrections, and is currently working as an RN case manager, assisting people all over the state. She's particularly interested in restorative and transformative justice and has 3 sons and 1 granddaughter. So we're very excited to have this amazing panel today. And so what I'll do is, because we're limited on time, I'm going to jump right into the questions so we can begin and really lean in on their expertise. And I'm just going to start with the first question, which goes to County Executive Crowley. And so Milwaukee County was the first county to declare racism as a public health emergency in the spring of 2019. And since then, nearly 30 counties have followed suit. So County Executive Crowley, to start our discussion today, can you speak to how the declaration came about and what's working towards racial equity has looked like in your county over the past year since then?
Thank you so much, Roberto, and thank you so much to NACo for providing this platform and all of you for attending. But one of the reasons why we decided to make racism a public health issue here in Milwaukee County is that if you look at Wisconsin, we continuously lead the nation in so many racial disparities, whether we're talking incarceration, education, but most of the time it also falls along the lines of health disparities as well. And so last May of 2019, we declared racism as a public health crisis. And what we did was, first thing we did was we had thousands of employees begin racial equity training. We started to also integrate this training also into our new employee orientation. And so 95% of those Milwaukee County employees that was actually assigned to do the racial equity training had actually completed it. And so building off that recognition, we also established our Milwaukee County vision, which is by achieving racial equity, Milwaukee is the healthiest county in the nation. Because again, when we look at the disparities, they largely fall on racial lines. And so during the 2020 budget cycle, which was started last year, our Office on African American Affairs started to participate in every budgeting meeting to ensure the racial equity impacts were taken into consideration as each department started to develop and refine their own budget proposals. And despite the fact that our structural deficit requires us, to make more cuts than investments, we made sure to look through a racial equity lens to continue and expand funding for racial equity training. That's whether we're talking about preserving bus routes that disproportionately serve Black and Brown communities, or changing the way that we prioritize our investments in our county park playgrounds. During this past winter, we trained hundreds of managers across the county in our new health and equity framework to ensure that they can lead their teams to address the root causes of racial equity. And it's not to say that it's going to solve all of our problems, because this is going to continue to be an ongoing theme. And so at the beginning of this year, we rolled out our vision for all of Milwaukee County employees through a week of activities to broaden and deepen a better understanding of what it means to really dismantle institutional racism and resolve racial health disparities across the whole county. And what I'm really excited about is that as we go into this new budget cycle, we're deploying a 2021 racial equity budget tool, which will help us transform our county services so the system serves everyone, no matter who you are or where you live. And so we just fundamentally want to change the way that we do business. And for the future, as we think about and we look at racial equity as a guidepost for everything that we do. So whether we're talking about building a diverse and inclusive workforce, making sure that we are meeting the customer's needs versus the customers figuring out how they fit within our programs. But more importantly, we want to continue to think about how we can also use this to generate more revenue. When we think about racial equity, we do have to spend the resources to achieve that. But when you achieve racial equity, it's going to make sure that when the tide rises, all the boats rise.
Thank you so much for that answer and for that. I'm going to now ask a question of Ms. Pierce. County Executive Crowley talked about disparities. And as we have this conversation today, it's impossible to ignore the reality of COVID-19 and the impact that the pandemic has had on our population at large, but in particular on communities of color. Ms. Pierce, your experience in advancing race equity spans decades and states. So given your knowledge and background, how do you see the COVID-19 pandemic changing the conversation about race and how counties capitalize on the current moment?
Thank you, Roberto, for that question, and good afternoon to my distinguished panelists. Certainly, COVID-19 has changed our lives in many different ways. In particular, when you're talking about communities of color, those of us who have been doing work in this space, advancing racial equity, this may not have come as a surprise that communities of color have been disproportionately impacted or even exacerbated some of the issues that already exist. And many have said that, we have a pandemic within a pandemic. We have COVID-19 and we have structural racism. And the combination of those two, as we can imagine, it has just really affected people in ways that many have not really expected. And so as the county executive mentioned, there are issues with housing, but particularly for health disparities, as we see that many African American and First Nations communities and also a Latinx population that, they've had some adverse outcomes. And what that has done in terms of conversation, people have been asking, like, what's happening? And that has been an opportunity for those of us who do this work to say, they say, well, is it about somebody's race? And we're saying we're able to change and shape that narrative. No, it's not about race. It's about racism, structural racism. It's about how our systems and our policies and our practices, really have contributed significantly, especially when we think about government, to these inequities that exist. And so then we have a role and a responsibility to do some work. Certainly, we didn't create our systems and institutions, but we do have a responsibility. There's a saying, I am responsible for the house that I did not build, but I now live in. And so I see that conversation as a welcoming conversation, that question of what's going on, what can we do? And it's a national conversation. So we can shift that narrative, people thinking that it's about a person being Black or brown or communities of color, that there's something deficit about who they are and how they show up, and explaining why they're situated differently in society, but then shifting that to systems and institutions and policies and practices, because that's where we can do our work and affect change. So I think COVID-19, again, has exposed and uncovered this deeply rooted, deeply embedded society in which we have racial inequity, so that people can really, we have more people asking questions. And so us coming together, we can really address not only COVID-19, but we certainly can address our centuries-long issue of racial inequities and structural racism.
Yes, thank you so much, Ms. Pierce, for that. And saying a pandemic within a pandemic, I mean, it really struck me thinking just about that. But you're right that there is a moment now and an appetite to talk not only about the pandemic, but to talk about race equity in a way that I've never experienced in my entire life. And so I think this type of conversation that we're having today is so incredibly important. But I'm going to pass it over to Supervisor Cronk now and ask a question, because as we're talking about racial equity, conversations around advancing racial equity have historically been dominated by larger, more urban counties. But we are starting to see an increased engagement in smaller and more rural counties across the country. And with GARE, that's a focus of ours. One of my counterparts, Shauna Davey, who's our South GARE regional manager, is doing some amazing work with some smaller counties in North Carolina. So with that said, Supervisor Cronk, with a population near 100,000 that's nearly 90% white, how are you able to hone in on racial disparities within your county and make the case for racial equity? And you're on mute if you're talking.
Thank you. Thank you. I really appreciate the previous speakers. And I think as far as our particular county, we have a lot of work to do in confronting many policies that have been in place. We've had racial covenants in housing in our history of our community, and how that has really impacted people's ability to not be able to build generational wealth. I think many people don't know that, or don't necessarily know our history of this community and how policies have been perpetuated, including through our county and through our services. So one way, our county board chambers, when we go in for meetings, we literally sit underneath our jail and our juvenile detention center. And as somebody who has worked in the jail in the past as a nurse, although the data wasn't there to show it, in a community that, you are correct, is about 95% Caucasian or 95% white, working in the jail, it was a very diverse group of residents that were there. And so I think, in the last year, we did a jail population study where all of a sudden now we have the data that has become public after some ask and some insistence. So we have in our community, according to the last census, about a 1.2% African American population, but we have between probably 17 and 20% in our jail. And so those are some serious statistics to have to start to look at and grapple with. I think that coming forward, now there's a lot of work being done saying we need data for every stop and arrest and every decision-making point that has occurred when we're just talking about our criminal legal system. And I really appreciate Mr. Crowley. I know when I saw that there has been an app now also for court records to say what have those decision-making points been like. And I think that's something that our county has to take a look at and start to confront and say, how do we want the health and wellness of our community to look when that's the case? Our Native population and our county building, again, we're on Native land. We have to say and own that we are on Native land. Every time we walk into that building and every time we're making decisions, that particular population is about double in our jail. So, moving in the sort of upstream way, what do our schools look like? The disparities in our schools, what are our graduation outcomes? What are our reading levels like? Who's able to, pay for and be able to take the ACT over and over again and get into colleges? I mean, how are we supporting our youth then in our schools? And I think when you have conversations with people in the community, it's very different than having conversations at times with people who are elected. And we have I would say, I don't know everybody's ethnicity on our board, but I would say we probably have 100% white county board. So now how do we look at ourselves and say, if we really want to start to confront these issues and not perpetuate policies knowingly, intentionally, or maybe unintentionally, we need to have people who are most impacted and most underrepresented at all of the tables, the decision-making tables that we're at, in order to lead and guide the work. And I think that's just something that hasn't traditionally been done, but it needs to be and it's going to be. And that, I guess, moving forward, when we want to look at our policies, because people have talked about and mentioned, it's about having racist policies. And we can have buzzwords to say we want to be have anti-racist policies, want to have an anti-racist community. But what does that work actually look like? How are we going to dig in? Yes, we passed a resolution. Did we do it to feel good, or did we do it to actually be committed to doing this work to build the racial equity that was mentioned before, because that can build revenue as we're all struggling to have, our budgets being affected by COVID-19. As we start to build these recovery budgets, I continually ask the question, as these task forces are being built, who is involved in these task forces? How do we have that wide representation to say we need to build this forward together? So who's sitting at the table too makes a huge difference. And I think those are conversations that we're grappling with at the county level as well. I hope I answered your question.
No.
And didn't go too far beyond. I do want to point out too, I think one of the things that's been a struggle too is you have a county budget, you have a city budget, you have the school board. We have a shared services committee that hasn't necessarily met for quite some time. So you have then these budgets that feel like they're separate, even though they're not. Our community is the same. Our tax money is the same. Our investments are the same. So I think really connecting and collaborating and understanding, what is the totality of what we're spending on our police budgets, whether it's the city police, the county sheriff's department, perhaps grants coming in for military equipment, all of that. And is that really our focus? Should that really be our focus? Or is there money that could be spent investing in Black and Brown owned businesses in our community. You know, how many contracts for services within our county budget or our city budget? How are those contracts being allocated? There's just all kinds of angles I think that we're really pushing to look at and confront as individuals, and then as elected officials. You know, we have a say and a vote in how these budgets and how these resources and how the repair, you know, is moving forward. Because we can talk about wanting to be reparative, but if we're not willing to invest in it, that's performance art, and we just can't continue to do the same thing. So I will pass the microphone, but that's kind of my answer of where things started for me and the conversations at the tables that I'm sitting at.
Thank you so much, Supervisor Crone. And I think, you know, you asked if you answered the question, but I think what you actually illustrated for us as well is just how interconnected all of this work is to so many other things. So when we're talking about racial equity, it's not like it transcends everything. And so, and all of the services that we provide and all of the departments that are working have a role, and they're a spoke on this larger justice wheel. And so I think your answer actually exhibits exactly the work that we're doing and what makes it so difficult sometimes. So I'm gonna bring it back really quick to County Executive Crowley, and let me ask this question. Though we've started to move towards, as we've talked about, an increased acknowledgement of racism as a social determinant of health, especially in the light of COVID-19, the movement still faces resistance when we talk about, you know, race as a social determinant of health. So, County Executive, have you encountered such resistance in working to further race equity in Milwaukee County? And if so, how did you address those barriers?
The short answer is absolutely we have. So I can say that first, when it was first announced last year, whether you were white or a person of color, it made you go, because the question is, well, what is it? What exactly is this? Is this a campaign ploy? Is this something that people want to do? What does the practice look like? And so we had to go out there and really educate people on why this was happening. Because once you bring the data to people, when you talk about education, talk about incarceration, talk about housing, it's kind of hard for you to say no when the data is literally telling us that we have to think differently. So we absolutely hit a lot of different barriers. But one of the ways that we began to break down those barriers is we didn't stop. We continued to talk about it, no matter how uncomfortable it was, not only for us, but those listening. And so we had to realize that, one, we all need to get comfortable being uncomfortable, right? And so once you start talking about the data and the issues, and if you want all the boats to rise, you know, you have to make sure that we are lifting other communities up. And I would say that it was really about how do we bring in more of our external partners into the fold as well to help push the narrative. You know, once Milwaukee County did it, we had the city of Milwaukee not too far from not too far the distance, a couple months, they decided they were going to do it. And we just continue to talk about it. And so one of the things that we've been doing here within Milwaukee County is looking at our policies, our procedures, and once other municipalities start seeing that we were seeing a change, we were making a change, a lot of folks were like, you know what, we don't want to be caught by the wayside. We need to step up as well and do something. Milwaukee County is the largest county in the state of Wisconsin. We also have the largest population of people of color throughout the state of Wisconsin. But the thing is that, I mean, Supervisor Crunk talked about small rural areas. We're seeing a growing population of Black and Brown people in those areas. And many folks are saying, you know what, because we see this happening, we need to make a change. And it was interesting because when Milwaukee County did it, the first group to come on board was many of the business groups, many of the executives, right? And, you know, so for example, I am the youngest person elected to this seat, and I'm the first African-American to be elected to this seat. And so when I won this seat, many people were looking around thinking, you may be the only executive throughout the whole county in the public and private sector. And so once we start having these conversations, many more people start to get on board. They start to believe in the mission of Milwaukee County. And I will say that it is an uphill battle. Sometimes I feel like I'm ice skating uphill when we have these conversations. But I will say that it's not impossible. And we have to continue to hammer home that if we want to all do better, we all have to do better. And that's making sure that we don't leave anybody behind.
Thank you for that. And thank you for sharing that. Ms. Pierce, both County Executive Crowley and Supervisor Cronk have talked about the importance of community and bringing multiple voices to the table. What's your experience in interacting with the community in some of the work that you've been doing? Because they both have talked about that. I want to make sure that you have an opportunity to talk about just your experience and maybe some advice that you have in terms of involving the community in this type of work.
I will say that I will echo what the supervisor and the county executive have said, but also I would add that community participation and leading in this space is critical. Often the community, they have answers, they have solutions, they have recommendations, and we really need to make sure not only, people say you could be invited to a dance because often we will invite them, to the party, but are we inviting them to dance? And so not only a seat at this table, it needs to be multiple seats at the table, and have a true voice, and we must value and respect and honor the voice of our community, because often they are mostly impacted by the policies and all of the things that we put in place. And often, when you hear from community, they can actually tell us where those gaps are. I have a story, a brief one, but that when those things that you talked about or asked, Roberto, how when we include community, the value and the treasure that they bring and information that they bring to us to better inform the work that we do. There just was a time when I was working in Texas, leading the state office of minority health, and a researcher came and said that she wanted to do some work in the community and do another research project on the underutilization of Medicaid by the children who were on Medicaid. And so, I asked the question, had this been done before? And she said yes. And we know that Einstein says that you cannot solve problems using the same thinking that created the problem. And often we're on a hamster's wheel, just hoping this time, for the 10th time, whatever we do will work. And the thing is, the hard reality that we have to face is that many of the interventions, programs, and services and initiatives that we employ that does not utilize a racial equity lens will not be successful. That's really hard because we tie ourselves to our work and we work really hard, but we have to know that every decision that we make, there's an opportunity to embed racial equity. So that's one piece. And so this researcher, I said, well, why don't we do something different? If we know that that's happened before, why don't we actually go and ask folks, why are you not utilizing this service? Why are your children not utilizing the services that we offer? Why don't we ask, how do you experience our programs and services? That's a very different question that will prompt us to turn the mirror inward and become critical lovers of our system. There are some things we might do well, but there are things that we need to work on to build our capacity, embed racial, and probably I would say all the things that we need to embed racial equity into our work. So to fast forward, we go and we have these community sessions. Now, we didn't create them. We asked to be invited to what was already happening in the community. And when we got there, we just asked a different question. And it was just a random community member, and I say community partner, because the people that we serve, the people that we do this work for, they're our partners, and we have to recognize that. And it was just a woman who just stood up and said, first of all, I appreciate that you came to our space with respect, that you came asking how we experience programs and services. She also said that, I know that when you make decisions in your boardroom, you have the best intentions. Did you hear that? She kind of really just told us off, but it was true that often we make decisions with the best of intentions. But she said, when you were in your boardroom, and she was quite sincere, and you made this decision about, a transportation service that you have that would allow people who don't have transportation to transport their child or children to receive services. She said, well, let me just tell you, unpack how your transportation service that you contract with works. First off, you have to make a reservation 72 hours in advance. And she said, well, let me tell you, I have not been very successful in scheduling my child's sicknesses. So scheduling something 72 hours in advance, if you have a sick child, just doesn't work. That's number one. She said, and number two, she said also only the child that you have an appointment for can ride on your transportation service. She said, so what does that mean if someone has one additional child or two additional children? Should I leave them home? And if I did that, I'm sure I will be involved in another system that you have. And then she said, lastly, and this is just at the top of her head, that she can rattle off how our policies and practices and procedures and who we contract with and how that works on the street doesn't quite work out the way we envision them. And the last thing she said was, well, there was a time that there was a well child visit. So I had time to plan, with the 72 hours in advance. I do everything that is required. The person comes that you contract with for transportation services, and he asked me a question. He said, where's your car seat? She said, well, I don't have a car seat because I do not have a car. And she said, and so he left, which is what he would do, because that's kind of against the law to do that, not have a car seat. And she said, so think about that, how that plays out. And if that's just someone exposing how our policies and practices really work or operationalize, that's a really important piece, how community is critical if we really want to close gaps and really advance racial equity. And that's just one little piece. And I hope that answered the question.
No, it does. Thank you so much. And I think it helps kind of reaffirm just how important involving folks in, because we do have, gaps in our way of seeing it, depending on our positionality and where we're situated within certain structures. And so those types of things are very important. I'm going to switch over and pivot just a little bit. Supervisor Cronk, I want to ask you a question. The COVID-19 pandemic and the murder of George Floyd by the hands of law enforcement, as someone who's worked in that sector, has created a perfect storm where the disproportionate impact and treatment on communities of color has come to the forefront. However, there's a concern that, as we tend to do, our country's interest will wane and we'll move on to the next topic. Even now, we're seeing significant less media coverage of the protests that persists in communities across the country. So in light of that reality, how does your county intend to keep its race equity work from being a response to a moment, so to speak, but rather a long-term sustainable effort?
Thank you. Sorry. I think that's a great question, because I think a lot of times we do have things that happen and people pivot and they sort of make quick decisions and then the momentum fades. So in answer to your question of how do you keep that momentum going, as a county, I think there's some very key people that will not let that momentum stop. I take ownership of that for me. So again, every table that I'm at, this is coming up and it's not going away. For me, I feel like we have a moment right now to decide what type of legacy do we want to leave. I said I have sons and I have a grandchild. My community has generations, hopefully, that are going to be coming forward. So for all of the things, the legacy that we didn't work on before, like the housing covenants, we've had many sundown cities in our state. What kind of legacy? I feel like we have this opportunity to change the trajectory and leave a legacy for our children and our children's children that's very, very different. We have young people that came out in force. We've had protests here as well. We've had rallies. People are now doing more Zoom meetings where they're having book clubs. People are discussing racism. People are looking at the policies. I think the city has been responsive in a way to now look at participatory budgeting, which they were doing a sort of already. The momentum was going. But I think even looking at how do they want to what does that participatory budgeting look like? And are you setting the agenda and the goals? Or are you having the community really set the agenda and the goals that you're trying to accomplish? We don't do participatory budgeting at the county level, but that's something that we need to be doing. And in inviting, not just inviting the public to come and speak to us, because many times that's very intimidating. People don't like to come to the county building. It represents many different things to many different people. And so how do we do outreach, more outreach? And I love, the idea of having people talk about, how have you experienced our services? Tell us about that. Tell me about that. I want to know what that looks like for you, because that's important in the creation of how we change things. Because again, you have this intention of creating this amazing thing, but then the practice of it and actually working through whatever it is, healthcare or transportation or budgets, investments, business, all of that. I think you have to be guided by the people that use the services, or the people, again, that are most impacted. I don't think our community is going to let this moment go. I really do not believe that. We have a university here as well, so there's been a lot of engagement now with our university, and how do we want again the holistic health of our community to look? How do we create public safety? And we know that if you have housing, if you have safe and affordable and accessible housing, because we can create all the affordable housing we want to, but if people can't access it, what does that really mean? How do we want our education to look like? What's being taught in our schools? What's not being taught in our schools? How are our teachers being supported through this? How are our students being supported through this? Have our policies within our school system been dusted off for a while and looked at? What do those policies look like? So no, this we can't go back. We're not going back. You cannot, and the murder of George Floyd, there have been so many, but that exploded, an international movement. These movements have happened before. The United States was connected when South Africa was going through apartheid. We were connected, but I don't think that we've ever been as connected as we are right now. And so, yeah, we can't let this moment go. And so I'm not the only one who feels that way, but I can represent for myself. It's been daily work. It's every single day. What can I do today different to make a difference? How can I work within my own bias and my own racism? What do I need to do? What is that self-work that I'm doing? How am I engaging with my community? Do I know my neighbors? Does that create public safety? Do I know only the neighbors that look like me? Or, how am I involved and how am I connected with the community that not only I serve, but I live in? I am a neighbor. I am here. So no, this movement will not stop. And I think it's actually such an amazing opportunity. When I hear George Floyd's daughter say, her dad changed the world. How do you hear that from a youth and not have the weight of that responsibility to do something every single day? So I guess I hope that also answered your question. And I think I just want to keep reiterating that I'm so appreciative of being here, because I learn, and when we connect like this, I learn. I've been talking about Milwaukee's vision every meeting that I go to, seriously, and pulling it up. Did you know they signed on to the resolution? And then there's all of this work that they did. Now there's an ordinance. It's within all of the employees, but it's also this, racial equity lens of everything that they do, everything that they are doing. And so I just think that momentum will continue. It has to.
Sure.
It has to.
Thank you for that. County Executive Crowley, I want to give you an opportunity to talk maybe a little bit about sustaining momentum, but given your really vast experience in being in the legislature, now being in your current role, you know, in talking about community, what advice would you have in terms of, you know, one, sustaining this momentum, connecting community, but then also, you know, there was a question in the chat about, you know, we've been talking about this race equity lens, but if you could talk a little bit about also about the race equity budgeting tool as well. So I think, you know, that's a lot in one question, but I do think that you come to this with, you know, from a unique perspective, and I'd really love to hear you talk a little bit about that.
Well, it's all about relationships, right? And a lot of the times, many of us, we are uncomfortable getting to know somebody who don't look like us or believe in the same thing as us. And we've had even types of programs throughout Milwaukee County where, you know, it was a thing called Partnership MKE that the United Way did that I was a part of. And it was like Match.com, but in reverse, where they actually match you up with somebody who has a totally different experience growing up than you. And we are able to have some candid conversations. And I think the issue is that a lot of the times we like to look at somebody else's experience through our own versus having a conversation to actually understand someone else's experience. And so if you want to sustain it, you have to make sure that you're building relationships with not only people who want to see the same thing, but who's willing to actually hold you accountable at the same time. So when we think about COVID-19, when it hit Milwaukee County, it disproportionately affected communities of color in the very beginning. And it still is when you think about the employment issues, the transportation issues, housing. And so when we thought about, okay, we received our federal CARES funding, where should we invest? We put 15 million into eviction prevention and housing instability because we know that was going to be critical for individuals, right? When COVID first hit, it was like, okay, how do we message to people about this? And before I came on, it was about, you know, safer at home. But that wasn't through a racial equity lens because growing up, you know, staying at home wasn't necessarily the safest place for me, right? So we had to change things up and we had to really start to hold ourselves accountable. And it's about making sure that when you build this table of diverse voices, there is a level of accountability there. You can't just bring on people who's going to be a yes woman or a yes man. It has to be people who are going to push you, think about, and push you to a point to where you're measuring where you are going, whether you're talking about a diverse workforce, whether you're talking about decreasing the amount of evictions that we see throughout Milwaukee County, or were we talking about, you know, our bus routes, just making sure that people can get to school, to the doctor, you know, or to work. And so this is really about relationships. You cannot do this alone. And if you go in alone, you're not going to go far. You may go fast, but you're not going to go far. If you want to go far, you need everybody to come with you. And that's an old African proverb. If you want to go fast, go by yourself. If you want to go far, bring people with you. And so it's extremely important that we keep talking about intentions, the best intentions. Nobody cares about the best intentions. We care about the results that the communities and our residents absolutely need at this moment. And when we think about that, the budgeted racial equity tool is really about, okay, who are utilizing these services? I think the commissioner, Ms. Pierce, said it the best. It's like, well, how was your experience, right? And a lot of the times we don't go outside of our own box. We may talk to our employees. We may ask those folks who may fill out the comment card, but we're not absolutely going to the folks who absolutely need these services and these programs in order to survive. Because, you know, here in Milwaukee County, we are the safety net for all of these folks. And so, you know, that's what we do. And so when we think about, you know, how we're going to make investments, how we're going to make these cuts, it's about, okay, who is this affecting? What zip code is this in? Or what municipality is this in, right? Because Milwaukee County, we have 19 different municipalities. The largest city is the city of Milwaukee, where maybe about 75% of our population that are of color live in. So when we talk about building relationships, I have to build relationships in some of these suburban areas for them to understand what we're trying to do as Milwaukee County. Not all of them are coming on board, but we're slowly seeing traction happening and folks saying that we need to do something. Because if you want to sustain your municipality, if you want to sustain economic growth or build back better once we are out of this pandemic, we need to make sure that we're doing it in an equitable manner, because we want to intentionally leave people by the wayside if we don't intentionally do things on the front end. And so we look at here in Milwaukee County, we look at how can we spend more money upstream versus spending this money downstream, which is costing us a lot more money. But until we bring more people to the table, I guess, and I'll leave with this, because when I say bring more people to the table, I always look at, especially during both of these pandemics, with COVID-19 and racism, how do we have radical meet rationale? And that's the conversation that we have to start happening, because many of the people who are affected by many of the decisions that we make, those unintended consequences, they're not at the table. We may say that they're radical, but we haven't brought rationale to their radicalness. And so we have to start building relationships, being genuine. And I would say that's going to be key. It's like, you have to be genuine. And I think the one thing that I have learned, particularly being in this seat, is that nobody wants to see elected officials and politicians anymore. They want to see leadership. And we have to step outside our comfort zone and have those uncomfortable conversations in order to make our municipalities, our region, a comfortable place for everybody.
So thank you so much for sharing that. And so what you said, I think, is a perfect lead into this next question, because you're talking about bringing folks and having conversations, even folks who are coming from different perspectives, different backgrounds. Maybe some are coming from organizing, some are coming from activism, some are institutionalists, right, that are coming to it from that work. With that said, this question is for Ms. Pierce, but I welcome comments from all the panel. So a key component to race-based work is understanding our history as a country, which provides context as to where we are today. So at GARE, part of our model in doing this is understanding government's role in race and inequity and the role that government has played. So, Ms. Pierce, you've worked to engage Durham County employees and staff in trainings to help further their understanding of and ability to navigate race professionally and personally, and also to be able to talk about it. So can you speak to your work with the Race Equity Diversity Institute, and how you've been working to build the capacity for your county staff to engage in these types of conversations and in this type of work?
Sure. I will say that that's been just really a key strategy that, we want to do different work, right? Because we're talking about structural racism. And, Neely Fuller talks about, when we don't understand racism and we don't understand how it operates, and he says, then everything we do will only confuse us. And so we know that we all have our different perspectives and ideas. And so we knew that we needed to, and actually in keeping with Race Forward and GARE, we needed to normalize the conversation around race. We needed to ensure that we were speaking the same language. There are definitions that we need to understand. When I talk about, racism, what is that? And so we knew that we needed to be grounded in, like you said, history and understanding what racism is and what it's not, and that it doesn't require intention or permission, that it spends on its own access, just operating. And then we knew that we needed to organize, right? That we needed to identify at all levels across our enterprise folks who really wanted to do this work, and champions at the highest level, even our elected officials, having them engaged. And we have one and just knowing who those folks are. And sometimes they're, people you can point out, or maybe not, but people, just grounding people in information like that. And I know, for instance, I could say even one of our commissioners who's an elected official, she will say, Commissioner Howerton, she will say, look, we're not just going to have things on paper. We're going to walk we're not just going to talk the talk, we're going to walk the walk. And so you have that, and then you have our county manager. So just identifying champions. So you have that normalizing this conversation and information that we need so we can build our capacity and knowledge, and just make sure that people have language and clear about our language and messaging, and then we can organize, just building our capacity that way, and then operationalize, right? That we want to develop action plans. So one of the things that we did, I really think was really important, was that we joined the Government Alliance on Race and Equity as an enterprise, not as a department. Our entire county enterprise joined as a jurisdiction. And what that did, just like it feels great talking with the panelists and with Roberto, because it gives a network of people working in this, doing their work in their spaces, in their jurisdictions, and we can share and we can build from each other. We have lessons learned, and it really helps. I said, what strategy are you using? What are you doing around budget? What are you doing? And so that's a really important key piece. And then from the training aspect, we partnered with another group. And so it's just like our supervisor said on the call, that we've turned this moment into a movement. Of course, we're not where we want to be, but turning this moment, because we don't want to miss it. And we're not going to miss it. And just building, and we have to be clear about, we are not going to miss it, because what it does, when we focus on those who are least likely to achieve the positive outcomes across all of our systems, when we focus on that, we improve outcomes for everyone, because we don't have to run out of safety, because we don't. It's a resource that everybody should be able to access. And so those types of things, just realizing that everybody can be safe. You know, not only one group or one community, that everybody should have an opportunity to be safe. People need to be housed. And so just, I think that's one of the key things that we did, was joining with like-minded folks, having mutual accountability at all levels, identifying our champions, and just working with, and you know what, with intention and with precision and being explicit, because that's really important. And just identifying race neutral policies and practices that we have. Because, and people say, how do we identify those things? Well, we look at our data. And if we see poor outcomes, disproportionate outcomes showing up by race, you know, that's where we could focus our attention, you know, to look at what policy is associated with that. And that's one important thing. And then, you know, we use a lot of language that maybe other people don't know, like racial equity lens, like what is that? And we need to start demystifying some of that language so that people can understand, and that we are clear. So, you know, I got really excited when you asked me that question. I don't know why, but it's just really, that's where our hope is in achieving racial equity, right? Because racial equity is a vision, and it's also a process. And so, yes.
Thank you. And I should say that I did not ask for that plug for GARE. So let's just be very clear. I do appreciate it nonetheless, but it was not intended. So I do appreciate you saying that. But I'll open it up to some of the other panelists talking about the role of training, and maybe just, you know, creating a baseline understanding of how to engage in these conversations. And what advice would you have? Because not everyone has the ability, or maybe even the desire, to talk about race and equity. So what advice do you give to folks, and even supervisor for you as well, maybe in smaller counties where some folks may even go as far to say, like, race is not a social determinant of health, and, you know, and may even push back to say that far, to say that. So for both of you, what advice do you have about the role of training and maybe even normalizing, as we would say at GARE, some of this conversation?
I'll let the supervisor go first if she wants to answer.
I think to piggyback on what's been said a little bit by Ms. Pierce, talking about, let's define. First, we have to define. Let's talk about the definition of what that means to us. And then you kind of work from that framework there. And I think too, you know, I guess it is a struggle. And so Executive Crowley said, you know, we have to be able to be uncomfortable. That's been a struggle within even the county, to be having the conversations, even to have the data come forward and be public knowledge. So I think having those, when I say confrontations, I mean having to confront where we're at, but we can't go anywhere if we aren't going to identify or really define where we're at right now. And then having those objectives and goals of where do we want to go? What are the outcomes we're seeking to have? Because that really sets the trail of what's the road you're going to take and the path you're going to take to get there. I think it has really been honestly a struggle, and that to highlight that is okay, and to say we can't quit. We can't quit because it's tough. You know, we might need to take a little bit of a break, and you know, everybody's got to go get their have a drink, maybe take a little walk outside or something, you know, have some water and come back. But we can't quit. It's not going away. I think too, you know, there has been the discussion brought up too about, you know, you can't just invite people to sit at the table and then they don't have any decision making authority or power. That doesn't really do much of anything either. So I think ensuring that when you do bring groups together, that there is that honesty, there is that level of, you know, it's almost like it is a circle. Everybody's going to identify, like, what are the rules of the group right now that we all are going to participate within this conversation? How do we do that? What do we have as a consensus of what do we need to have this conversation be able to be honest and to be able to dig in? I love the idea of sort of the match.com in reverse. And that's something that I'm taking away that I think would be actually really great here. I know, you know, we have a lot of folks that engage in like one-to-ones. So they deliberately do go and try to, you know, talk to people or ask, you know, leaders or the champions that Ms. Pierce was talking about. Like, people will get together and they will do those with each other to try to figure out, like, okay, what are you engaging in? What do we need to bring forward? That, I think that's been happening a lot, but then to continue that. And that's a huge takeaway for me from Executive Crowley as something maybe we can start doing here within our county for people that are having the struggle, having those conversations, or that wouldn't necessarily connect. I think, you know, having that matchup is really, really key, because you learn things about people that you wouldn't know, and it brings that humanity and that humanization of each other to the forefront when people are able to do that.
Thank you.
I guess if I had to give advice, is like, one, you have to be comfortable being uncomfortable of having these conversations. But it is important to also recognize that there's this spectrum of wokeness, and not everybody's going to get there right away. And recognizing where people are, so you don't push too hard sometimes, because you may just push them out of the movement. So you have to recognize where people are and try to and slowly push them forward. And especially those who work in this work, especially those you know, people of color in general, specifically, sometimes it get exhausting having these conversations, right? Just talking about your experiencing and stuff like that. So it's extremely important that you take time away for self-care, and that's anybody in any movement, any of this type of work. You have to take a step back and focus on self-care. But the other thing that I get an opportunity to talk to a lot of people about this, particularly white groups. And one of the things and I'm very candid when I have these conversations. And one of the first things I always say is, it is not people of color's job to solve racism, right? And we have to recognize that we have a role in getting people to understand what is happening. But white people actually hold the power of dismantling this institutionalized system that has been in place for so long. And so you have to start, one is educating yourselves on what is out there, and learning more about history. And one of the things that, you know, it used to make me mad, but so many people was like, well, everybody's just reacting to George Floyd, and everybody's reacting. And it's like, when people ask me, well, how long have you been marching? It's like, they've been marching way before I was even born. And this is not a reaction. The thing is that COVID-19 has eliminated so many of the distractions around us, that many people are now finally understanding what people of color have went through in this country, or forced to kind of look at what is happening in this country. And so we all have a duty, and we all have a role in dismantling structural race, institutionalized racism, structural racism. But I will say that every role isn't for everybody. And so we need to recognize where our lanes are, how we move people forward. But again, we have to be uncomfortable we have to be comfortable being uncomfortable.
Thank you. And I think that's a beautiful place to kind of stop, you know, here. You all have said some brilliant things, and there's been some wonderful one-liners in here in terms of what spectrum of wokeness. I wrote that down. I like this to to lead in. So, and I love all the terms I've been using, but I do want to open it up to our audience who has been watching and just absorbing so much of this wonderful advice and these experiences, and open it up to questions in the chat. To do this. And there's already a question in there, and I think this is a good one to lead in since we were just talking about training. But in your counties, has every employee done a training? And if so, was it mandatory?
So here in Milwaukee County, not every employee has went through it, mostly because the COVID-19 pandemic has really stopped everybody from being able to participate. But we did not make it mandatory. Now, we did make it mandatory in our new employee orientation. And the reason why we didn't make it mandatory is because we want people to conform to a new culture, right? And when you think about this new culture that we're trying to create within Milwaukee County, some people are not just going to come along. And then once you force them to come along, you may have some other issues. So what we look at it as that once we have a culture that is in place, those who don't want to be a part of this culture will find ways to get themselves out of it. And so, and the thing is that you want to make sure that the people who want to be there want to be here. And so that's who we want to continue to pour into and invest in when we think about moving racial equity as a public health crisis. And so, because, one of the biggest things, like when we started having this conversation, people didn't understand, what equity meant versus equality. And it's a big difference. And so, again, we are here to make sure that we're bringing along those who want to come along. And again, we're not firing people because they haven't went through the racial equity training, but them folks will find ways to remove themselves from being a part of the bigger picture.
For Durham County, we have not required training. Certainly, we have invited folks to receive training, and we haven't had enough opportunity to, of course, to train everyone in our organization, but certainly that's an aspirational goal. And we see this entire piece as invitational, because as much as inequity has been embedded in our systems and institutions, we want to embed racial equity into our institutions. And so, certainly we would want to offer training across all of our departments with every staff member. But I do agree that we don't want to drag people on a journey. We want to invite them. And but what I will say, just from my experience, I don't count anybody out either, because across systems, I work across systems with our judges, criminal justice, juvenile justice, school system, any partner, corporate, any partner that wants to engage in this, because we're all part of our community. And the more we know across systems, the better, right? And so, we're putting something in place similarly that, when people are onboarded, what will they know about racial equity that we can share with them at that point about our culture? So I think that's key. But no, to this point, we have not required that.
We are not requiring training here either in Eau Claire County. And I think we're at the point actually where we're figuring out, like, what is this training even going to look like as it's being created? So I think we're almost in those stages, maybe more in the infancy than either of the two of you, and trying to figure out, like, how is this going to look, and who's going to be engaged in that. Those are conversations that are happening. There was a diversity and inclusion committee that was formed. It was probably maybe a year-ish ago that started looking at and working on policies for our county. But then that actually, those conversations got very difficult, and that group is not the same anymore. The members are not, the group is not constituted of the same people anymore. So that is something, as part of this resolution, there was a reference to, no, we need to have a group that is working on this for employees, and within not just our human resources area, although that's key, but it's every area. I think sometimes departments will start to say, or individuals will start to say, like, well, if it's, it could be duplicative if there's already another department working on this. And it's like, this isn't sort of the proverbial hot potato that you just pass. We all have to be working on this together. But as far as the training goes, I think that's something that we're looking at, or the county is looking at to try to implement. So that's something, obviously, if we stay connected, maybe listening and learning more about what others have done and how to incorporate that.
Thank you so much for that. And again, one thing I want to open it up to is please type in some questions in the chat, but also for those of you that are calling in, I want to give an opportunity to you all to unmute and ask your questions, because chat may not be an option for you. So is there anyone that is on the phone who would like to ask a quick question? And then I'll hold for a second and then maybe read some of the questions that are in the chat as well.
Hello, this is Brenda Howerton, Durham, North Carolina. I just have a quick question. I'm looking at the complexity of your group and wondering why you don't have a white person. You are all people of color, so why there's not a white person in this conversation?
I think I'll take sort of a step at that one. I am here and I am white. I'm not sure if you can see me, and I hope that answers the question.
From the screen, you appear to be a person of color, and that always concerns me when all you have are people of color having a conversation about racism.
Yeah, and that's, I think, thank you for that question. And I think that is also part of the complexity of this work, is phenotype. In addition to, even if you do see people of color, that doesn't mean that they support and or are part of moving equity forward. So I think that is also something that we need to be cautious of, is assuming that folks of color have had the opportunity to have really in-depth equity kind of understandings and work. And that's why I think this training is important, that it's so very, and that's why I led in with that quote of just how complex and that it's ripe with contradictions and there's so much that's going on. But I do appreciate that question, and it does force us to think about this in very complex ways. So thank you for that. I do want to add, one of the questions that showed up in the chat was, what recommendations do you have for how to best message around race equity in more conservative environments? So what advice would you have in terms of that, about having this conversation in conservative types of spaces?
That's a really important question. I think one, there's so many cases to make for to do work and to advance racial equity. One is financial, right? That it costs money. Inequities are terribly expensive because you spend a lot of your resources trying to fill in the gap, trying to address need. And so that's one piece, that if people have housing, if people are safe, if people have jobs, if people have opportunity across multiple systems, if people, when there is equity, that's a case that we don't spend a lot of money to address inequities. And it's a business case to make. And then also just having the conversation that, our systems were created before we came to them. It's kind of baked in, these inequities, and that each one of us, we have, and each of us has an opportunity and a responsibility to do this work, regardless of where we sit, and that people are dying unnecessarily, or people are languishing in our systems unnecessarily because of inequities. And quite frankly, it's just the right thing to do. And so it's just that sure and flat-footed that we could just sit with some of those things, that it really is important that we just do the right thing. And yes, sometimes those, just making that case, making sure our case is strong, is based in data, and we can share the data. And that's really important, that I don't want to say expose in the sense that we're hiding it, but show where our data is, because we like to show some of the things that are great and good. And, we say, oh, look at this, but just saying, look at our data. and it's showing up by race. And that, you know, race in itself is a social construct. It's not biologically real, but it's real in how people live out their lives because of how we're situated differently in society and stratified and by race. And so those kinds of conversations, just laying out the information, the data, and making a strong case to advance racial equity or to improve the outcomes for the people we serve goes a long way. And I've done some work in some really conservative areas, and I worked and served where there were 27 million people in 254 counties. And I went to many different places that people say, I know I'm not interested in this. I said, well, are you interested in that we can have, you know, more kids safe or more kids alive or less, you know, moms, you know, dying during childbirth and they said, absolutely, let's do that. So.
And you know, I like to call myself an organizer that happens to be elected. So one, I would say you always need to know who your audience is. I think a lot of the times when we look at, not all conservatives are the same, right? So if you live in Milwaukee County and you're a conservative, and you live in, you know, I don't know, Wausau and you're a conservative, it's a different type of conservative mindset. And so one, I would say know your audience. But this is an economic argument also to have. This is a health argument to have. You know, if we can get more people of color more access to health care, how much does that reduce your premiums, right? If we can get more people access to a better paying job, how much does that reduce your property taxes or your sales taxes in your neighborhood, right? And I think that we just have to figure out, one, who are we talking to, you know, before we go out and peg this idea or this perception. Because I think there are some conservative areas who want to tackle this issue, but a lot of them won't say Black Lives Matter, right? So how do we have that conversation? I think it's really about who the audience is, but I would say that you don't stop. You just continue to have that conversation, because many of them, you know, a lot of people will say that being poor and Black in a city is no different than being poor and white in a rural area. We just haven't made the connection. We haven't focused.
If you could,
I think I got
yeah.
muted for a while, but it's really about just you got to continue to have that conversation. We can't be afraid, and we don't know who we're talking to until we actually talk to them. Because I think there's a lot of conservatives out there who want to figure out ways to pick up the mantle and do some things. They just don't know how to do it without being ostracized in their own community.
Thank you. And I really hate to stop it, but we have like 2 minutes, and I want to be able to get back to the commissioner to be able to close us out. Thank you all so much for your insight, for your expertise, for your recommendations. I am a better human for having been a part of this conversation, and I'm honored to have been a part of it. So thank you all so much. I'll pass it back to you, Commissioner.
Thank you. Thank you so much, Roberto. You were amazing facilitator here, and County Executive David Crowley, Joanne Pierce, and Supervisor Kimberly Cronk. Thank you for all of your wise words. I learned so much. I did not want it to stop either. I wanted to just to keep going. But thank you so much. And Roberto, I hope you'll put some information. Well, NACo will have it if we're more interested in what GARE is doing. I wanted you to talk a little more about that, but we are gonna, let people, be off the Zoom call. But the Government Alliance for Race and Equity, I think, is an amazing organization, and so I want to know more about that. So we'll get some more information from NACo on that. But just in closing, I just want to say what an honor and privilege it's been for me to be the chair of Healthy Counties this year. I am not going away, though. I'm excited to continue to be vice chair. And so we'll be helping out our new chair, Ken, and we'll just continue to do this good work. Thank you all. Thanks, everyone, for being on this call. We kept most everybody this long. Wow. This was just a really, really great conversation. Thanks for all of your work and for your continued service service for all of the people of this great country. So thanks again, and everyone be safe and be healthy, and look forward to seeing you in person.
Thank you.
Thank you, everybody.
Thank you all.
Thank
Bye.
you. Thank you. Thank you.
Stay well.